perspective now from physician and public health specialist and Dr. Yalda Safai. All right, doctor, good to see you. What is your perspective on all of this? We'll start with how Kennedy is kind of now handling it and what we should be talking about.
Well, it's promising that he's backed away from some of the misinformation he was spreading about vaccines. But I think the reason he is now, backing away from those claims is that this public health crisis is now his problem. Before it wasn't. And the outbreak we're seeing right now is a direct result of what vaccine hesitancy could cause. Measles is a preventable disease. That death could have been completely preventable. So I think now what you're seeing, the change in tone, is because now this is his problem and before it wasn't.
These numbers, I was looking, we could put them up on the screen about exemptions to the vaccine in Texas. So, it's interesting what's happened over, I guess it's the last decade or so, right? Because if you look at 2014, MMR vaccine exemptions were at 0.76% of the state. But now you fast forward to 2024, the number's up to 2.3%. So is it just Texas? Probably not, right? What's going on here in the last decade or so?
Oh, it's not Texas at all. This outbreak happens to be in Texas, but there have been outbreaks here and there over the past decade or so. But this is a direct result of the vaccine hesitancy movement we've been seeing for the past decade or so. This was supposed to be an eradicated illness, but now we're seeing a resurgence of it. The problem with measles is it's extremely contagious. One person can impact 8 to 10 people. So if one person comes to kindergarten with measles, they're endangering 8 to 10 people. And sometimes there's kids in kindergarten or preschool that are too young to get vaccinated or have an underlying health condition that prevents them from getting vaccinated. So Kennedy keeps preaching this is a personal choice, but when you're affecting other people's health, it's no longer a personal choice, unfortunately. So to answer your question.
From some parents who have young children, I think, and maybe they conflate a lot of different things at once. They say now, especially, and I don't remember this when my kids were young, it wasn't as prevalent, I don't think, about how many vaccines, especially young babies, are getting in one doctor's visit, at each time. So they say to themselves, well, do I want to wait a little bit? But with measles, measles has been around forever. This is one of the main ones that you should be getting right at a certain time. I mean, what type of advice do you give to parents? Because I know that is an issue that I've heard about where people come in and say, why am I getting, all these shots at once?
Sure. I'm glad you mentioned this. Well, the measles vaccine has been around since the 60s, so
Right.
It's not a new vaccine. We know it's safe. We know it's effective. We know it's necessary. If I understand how people have hesitancy about getting too many vaccines at once, so I think it's really up to the pediatrician to be able to come up with a schedule to make the parents more comfortable if that is an issue. But this schedule is given for a reason. There's certain ages that you are now eligible and your body can tolerate the vaccines. It's not, the pediatricians have come up with this vaccine schedule based on years of research. But I think if you are faced as a physician with a parent that's hesitant, it's really up to you to make them as comfortable as possible, but try to encourage them to get it as soon as possible. Because if you send a young folk who's not vaccinated to kindergarten, to preschool with other people who, are not vaccinated, might have measles, you're putting them in danger. So it's the best idea to get them those vaccines as soon as possible.
All right, Dr. Yalda Safai, thank you for your expertise on this. We'll follow it in Texas and everywhere else.